Have you ever wondered what it is that some of the most influential carnivore advocates know that make it so seamless to thrive, while so many others struggles to see results? Is it because they simply eat more meat than you, or is it because they just eat less of everything else?
Do people fail the carnivore diet, and what are the reasons for the failure? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. In this video, we're going to hear from Steak and Butter Gal. I've reviewed some of her content before. She's lost weight and maintains weight on a carnivore type diet, eating steak and butter gal, her tagline. And so she's going to go over, in her experience, reasons why people try and fail carnivore diets and what you might be able to do to succeed. So let's see what she says, and be sure to wait till the end where I give you my final thoughts. Before we dive into today's video, I want to personally invite you to join my Reverse Type 2 Diabetes online course. In this course, you'll learn exactly how to implement a ketogenic diet safely so you can reverse your type 2 diabetes and prediabetes for good. This is truly a transformational and proven program to help you achieve normal blood sugars and be free of type 2 diabetes without medication. Enrollment is open now through February 17 only. See the link in the description below to sign up. I look forward to seeing you there.
The secret is not just what they're eating. It's what seasoned carnivores know that you don't, and the game-changing strategy they swear by, yet many newcomers overlook. Without this critical step in your carnivore journey, many will find themselves frustrated, stuck with stalled progress, or even abandoning the diet altogether. Does this sound like you? Now, imagine having consistent success and genuinely enjoying the benefits you've been hearing so much about. In this video, I'm going to explain what this strategy is, why it's important, and how you can effectively integrate it into your carnivore lifestyle for maximal effect.
Always consider the source. And while Steak and Butter Gal is not a doctor, not a dietitian, she has a lot of her own personal experience and now experience through helping other people and having a group, a tribe, if you will. And so we're learning a lot of people gain experience in the real world. And this is a grassroots type of change where you may not get the best information from a doctor, a dietitian. And so I think it's legitimate to ask and learn from people who are doing this, but always consider why they did it and where they are in their journey. And for example, Steak and Butter Gal didn't need to reverse type 2 diabetes. And so if you're doing this to reverse type 2 diabetes, you may want to learn from someone else at first and then come back here and learn more detail. But I think we're going to learn some general principles based on what she's learned from her followers.
So what is this elusive strategy? It's not just about choosing the right cuts of meat. It is about mastering the art of preparation and by planning ahead. I have spent a lot of time over the years with phenomenal doctors, athletes, and carnivore advocates who've healed everything from metabolic disease to cancer. And what all of them have in common is having a game plan for every possible situation that life could throw them off course. How can you effectively master the art of planning like some of the most influential carnivore advocates out there? To know how to plan, we first have to know what exactly to plan for. So I'm going to give you a quick rundown of the top 3 sticky situations you will likely need plans for and what exactly those plans are. The first situation where you will need a plan is literally the first and perhaps the most treacherous one. Headaches, fatigue, bowel changes, and irritability all waiting to knock you off your game. This is called the adaptation period. As your body begins to let go of its carb crutch, you might experience headaches, a little weakness that seems a little persistent and demanding, urging you to surrender to a more familiar energy source, which we all know is glucose, carbs, sugar, the food that we've probably spent our whole lives eating. You may even experience digestive discomfort as your gut adjusts to a new way of processing the food you're eating.
Yeah, so the information about understanding the keto adaptation process is really important. And hopefully, if you're getting started on a new approach, you'll take the time to learn from somebody who has done it and taught lots of people. Of course, if you're in a clinical setting, you're one of my patients, you're on lots of medications, I might have advised you not to add in salt or other electrolytes during this first keto adaptation phase. So if you're otherwise healthy, you're not in a clinical situation on medications, add back salt, and that's going to be adding a bouillon cube or other electrolyte sort of source that will minimize the transition called keto adaptation to a carnivore or keto kind of diet. But just use caution if you have high blood pressure or other salt-sensitive condition like heart failure or kidney failure.
Leaving you wondering if this journey is really worth the struggle. Add that to the irritability that can leave you feeling like a wall clock, swinging between determination and doubt. And it's clear that this adaptation period can absolutely be a formidable obstacle. Of all the people that I have met personally who have been on carnivore for days, months, or even decades, I've never met anyone who adapted overnight and did not struggle with some, if not all, of these adaptation symptoms. So this is why I have a well thought out strategy to make the adaptation period as short and painless as possible for you. When it comes to the plan, there are two camps, and I'll tell you what to do for both. The first camp is less common, and it's the cold turkey camp. This is self-explanatory, and it often involves an all or nothing mentality. For those who thrive on immediate change and have a strong mindset, this strategy can work. But honestly, I wouldn't recommend it because you will be facing adaptation symptoms right from day one, and you will feel a lot of pressure with no room for error. And I'm saying this as someone who did it myself. I went from vegan to carnivore, cold turkey, overnight, done. And to be honest, I don't think I would have had to struggle with as harsh of an adaptation period if I had just transitioned slowly and gradually. This really all boils down to your personality and what approach you want to do.
Well, this is fascinating because we don't have head-to-head clinical trials of carnivore versus keto. What I teach is 20 grams or less of carbs with leafy greens, with 1 cup of non-starchy veggies. And I don't hear the same sort of, everyone gets these symptoms and it's really hard, and yet I use a cold turkey method. It even occurs to me that that little bit of greens and other non-starchy vegetables might mitigate against oxalate dumping, which is something that I don't see in my practice. I didn't really know anything about it until more people doing carnivore and Sally Norton started talking about oxalate dumping. It became apparent in my clinic when people came and told me their stories that this was a real thing, but the way to mitigate or reduce it is to have a little bit of oxalate containing foods, those greens and vegetables. So I wonder, the comparison in that studies that should be done, I think, when the time and money present themselves, is to see which method, the cold turkey or gradual, and maybe you should have some greens at first before transitioning total to a carnivore approach. I think a lot of people are just diving in without knowing how to choose. I wouldn't know how to choose or how to direct someone either. Most of the low-carb studies that were done with a kind of a cold turkey approach. You all on one day, you stop the carbs, the addictive element, you go through a withdrawal. But alternatively, in the smoking cessation world, some people would do a warm chicken, not cold turkey, where you reduce the cigarettes over time and even reduce the amount of nicotine in the cigarettes. So I think this is interesting, and it may be more than just a personality thing. It might be a physiologic predilection that would make one go one direction or another. I think that would be a great study to look at cold turkey versus gradual transition.
And with adaptation comes the second situation where you'll need a plan. It is one we all find ourselves in occasionally. Standing in front of the fridge or pantry, cravings and temptations can hit at the most unexpected or vulnerable times. These moments of weakness can lead to a cheat day or even a cheat week, or maybe even falling off the wagon altogether and finding it difficult to get back on again. When left unchecked, succumbing to cravings will derail your progress and morph into a pattern that creates frustration, making it super easy to question why you're on this crazy carnivore diet at all. So, what is the best defense and how to stay prepared? The best defense to cravings and temptations is to have a solid plan that you can rely on every single time. And the name of that game plan is meal prep. By preparing carnivore-friendly snacks and preparing carnivore-friendly meals well in advance, you can equip yourself to combat these urges head on. Another important part of this prep process is addressing temptation and controlling your environment to the best of your ability. If you're used to burger lunches and pizza dinners, how will you fare when those adaptation symptoms hit and you've got cookies conveniently stashed in the cupboard? It might be helpful for those of us who cannot moderate by purging your fridge, your entire kitchen, all of your pantry. If they are not in sight, then obviously they are not an option when you are vulnerable. For those of you who are on the gradual elimination approach, relying on whole foods like fresh fruits and veggies temporarily is totally fine. As long as they're single ingredient foods that were not created in a lab and does not have a whole slew of ingredients, then you are good to go. Stock up your fridge with meats that you can afford and enjoy. Remember that craving episodes are strongest during adaptation and detox.
Did you notice the refrigerator was just full of meat? Well, one benefit of a carnivore diet is the simplicity. You never wonder what you're going to have for dinner because you're going to have meat. And of course, that's a downside for some people, but it's an advantage for others. What we're hearing, I think, is great advice, and it depends on the individual and the level of carb addiction. The idea of moderating and gradually reducing does not work well if you're highly addicted to the foods. And so I would argue that the cold turkey cessation is a better method if you're really dealing with an addiction. But we have a whole spectrum of people now, many of whom are not fully addicted to carbs, who choose to eat this way and just feel better. They're not necessarily reversing solid medical issues, which you can be doing. So again, consider the context with where you are when you're coming to this and listening.
The third situation where you will need a plan is one you may already be finding yourself in currently: social pressure. And oh, how strong it can be if you are a carnivore. Let's face it, eating only or mostly meat even is still considered unhealthy and extreme by the world at large. So it is no surprise that you might encounter skepticism or outright disapproval from friends, family, loved ones who just don't understand this lifestyle. The constant questioning and the unsolicited advice can definitely lead to feelings of shame and insecurity, making every gathering and social function a chance for you to second guess why you're on a carnivore diet. So trust me, it isn't easy announcing to the world that you now only eat meat. I get it. But here's the good news. You're not alone. And having a solid plan can turn these intimidating situations into opportunities for confidence.
Yeah, great advice. And this advice could apply to any sort of dietary pattern, whether it be carnivore or keto or even vegan. It's just that the type of food that you have at the ready is going to be different. And then the acceptance will be different based on where you are. But I think those are excellent strategies. And I have to say, she has a lot of experience in this particular domain. And keeping it simple is a theme that I like in the keto world as well. And I think keeping something simple enhances the sustainability. You're not worried about having something new all the time. You're not having to worry about super clean food all the time. But then that's an element of our program that may not necessarily be part of Steak and Butter Gal. But I like the approach. I certainly like the results that people who do carnivore diets are getting, even medically significant results that I see in my clinic. It's pretty amazing to follow. If you like, please like, subscribe, and ring the notification bell, and look out for new content every Wednesday and Friday. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.